Hello, my name is Paula and I'm originally from Peru. Since early 2020, I've been working in a medical ship that takes free primary health services to remote communities of the Peruvian Amazon basin. A few months ago, we launched a research based mental health program. In order to inform our intervention and make it sensitive to the specific sociocultural characteristics of the people we work with, we designed and conducted the following study, named Mental Health Needs Assessment of Remote Amazonian Communities in Loreto, Peru. Although the Amazon rainforest comprises over 60% of the Peruvian territory, communities have been historically excluded from the country's socioeconomic development. They are often isolated and live in extreme poverty, with no access to basic services. Although these factors represent powerful determinants of mental health, there is little to no research into the psychosocial needs of these communities. Therefore, our objective was to assess the mental health needs among members of rural Amazon communities in Loreto. Using a qualitative approach, we conducted interviews with 152 consenting adults from 45 communities along the Ucayali River. Interviews were audio taped, transcribed, and coded using thematic analysis. For the results, Bronfenbrenner's ecological systems theory was used to organize mental health vulnerabilities and strengths into four systems. I will start describing some of the vulnerabilities that we found. Within the macro system, we identified traditional gender roles that endorse gender-based violence, as well as shared beliefs supporting the use of physical punishment against children. Exosystem needs included low-quality education, absence of primary health and mental health services, threats to the environment, and extreme poverty. Within the microsystem, we found intimate partner violence, child abuse, and a high prevalence of family losses. At the individual system, we identified manifestations of depression and anxiety, as well as personal histories of violence and early trauma. In terms of strengths, we found a strong sense of community, identity, and belonging. The most prevalent strength among the exosystem included community organization and cohesion. Within the microsystem, we found strong support networks among family members. And individually, we identified personal agency and resilience. As we've seen, Amazon communities find themselves in a situation of vulnerability, facing multiple risk factors that have been aggravated by the pandemic. Mental health needs in each system seem to be interdependent between one another, which is consistent with Bronfenbrenner's model. Moreover, trauma and violence seem to be transmitted from one generation to the next. There were almost no life stories that didn't involve a history of trauma and abuse. In conclusion, mixed research methods are required to further capture these communities' idioms of distress in order to inform interventions and public policy. However, it's crucial to continue working closely and horizontally with community members, as well as using a multicultural, intersectional, and interdisciplinary approach. Further details into the study, as well as acknowledgements, can be found in the poster. Thank you very much.